heart valve disease is a common disease. And the problem is that as heart valve disease affects mostly older people, those symptoms get masked by the natural signs of aging.
People think that trying to climb the stairs to the bedroom and be related to that, getting slower is related to age and not something related to suffering from heart disease.
Despite some excellent therapies that exist for heart valve disease patients, sadly the awareness in the general public is very low. Also, there's a lack of data, perhaps, a lack of data in prevalence, in patient outcomes, and the inequalities of treatment that exist right across Europe.
If the heart valve disease is severe enough, people will experience symptoms. But sometimes when developing a heart valve disease, people don't experience symptoms. And that's when we have a huge problem.
In terms of the first test, it would be to see your family doctor who can listen to the heart with a stethoscope. And if they hear an abnormal sound, what we call a murmur, that can signify valvular heart disease or heart valve disease. In a lot of cases across Europe, patients over 65 are not having that stethoscope check. So a survey showed that over half of patients aren't having that test done. So while the stethoscope check may indicate there might be a presence of valvular heart disease, the echocardiogram is a crucial test because that diagnoses the presence or confirms the presence and then diagnoses the severity of that disease.
We are too late in diagnosing these patients and we are too late in treating them. I think clinicians have a very important role in helping patients to improve the knowledge and the awareness of their disease and also their management.
Follow-up care is very important. Sadly, it is often forgotten. What I experienced is that after leaving the hospital, the challenges of going back to everyday life is just starting. So I think patients need tools to cope and work towards full recovery, and so psychological support is very essential.
It is time to reach out to policymakers about the needs and the unmet needs of patients with valve disease. Valve disease in the long term affects and deteriorates the function of the heart itself. So if you operate too late or if you intervene too late, patients may not get the entire benefit because some irreversible changes in the heart have occurred. So from an economic perspective, and of course from a patient care perspective, it is critical to make an early diagnosis and intervene early as necessary. So with everything we've learned about the need and the opportunities to improve the well-being of patients with valve disease, let's get our act together and do everything that's needed to improve on patient outcomes.